we go. Okay, so I've started the recording, and we will have this recording on our YouTube channel. It'll be on the Families Helping Families Region 7 YouTube channel. Stacy, do you have a YouTube channel, or do y'all post the recordings anywhere?
We don't have a YouTube channel, but send it and we'll make it available as well.
Okay. Okay. So we'll do that. So the recording will be available, but you will not be able to receive CEUs from the recording. So it's only from the live event. So I have to say that so that it's on the recording, so people watching the recording will know to not expect these. So welcome and happy Friday, everybody. I'm excited. This has been, we've been working on this for quite some time. We actually started in December, even before then, working on this. So I'm excited that we finally got it going, and today is the day. So my name is Monica Stampley, and I am with Families Helping Families Region 7. And today I have Stacy Guidry, who is the Executive Director for Families Helping Families of Northeast Louisiana. And Stacy, please, if I say something that's wrong or you input, just cut me off, okay?
No, you always do a great job. Let me interrupt you real quick though. There's a little confusion when you said that you do have to be here for the live event. So someone was asking if you had to be in person to get the CEs. You do not. We aren't having an in-person meeting. It's Zoom only. So if you're here with us and you stay the entire length of the training today, then you will receive the CEs at the end of the training.
And we'll tell you the secret on how to get those at the end. Thank you. See, I'm not watching the chat, so it goes by too fast for me to read. So I need it to go slower. But thank you. I appreciate that. But we're going to start off this is Milestones Matter. And then what we have for you today, Stacy and I are with Families Helping Families Region 7, but our special guest besides us is Julie Emery, and she is the Learn the Signs Act Early Ambassador. And this is what I really have to read. I know the Learn the Signs Act Early, but Office of Public Health, Bureau of Family Health Medical Home Coordinator. So that's what I wanted to make sure I got right on her as far as where she is and who she is. But LTSAE is the acronym for Learn the Signs Act Early. So, and we are going to be talking in a lot of acronyms today. Feel free to put in the chat. We always try to say or say what the acronym is before we actually use the acronym, but everybody knows it, we're just so used to it, and we use those acronyms every day. So if you don't understand one or know what one is, please feel free to put in the chat. And as you know, Stacy is going to be monitoring that. So at least I will too when Julie's going, but when we're presenting, then I'm not going to have the screen to see the chat. So Stacy I'm putting it on her. She is monitoring the chat. And so if you have a question about anything about, we will have time for Julie to answer your questions. And then after Stacy and I present our portion, we'll have questions then as well. But if you want to put them in the chat throughout that time, that's fine. So I think I've stalled. I've done pretty good with stalling. I think we've slowed down to people coming in, and I think I have said everything all the housekeeping things. And I'm going to go ahead and turn it over to Julie and let her get started. Thank you.
Yeah, thanks, Monica. Hey, guys, I am super excited to be here today. Happy Friday. I am enjoying seeing how many participants we have on. And as you guys are putting your name in the chat, I'm loving how many areas across the state is represented, how many entities you guys are all doing different things in different capacity. And this is really enjoyable to see. Like Monica said, my name is Julie Emery, and I am the Medical Home and EPSCT Coordinator for the Bureau of Family Health, which in a nutshell means that I do a lot of work to promote and elevate the services that kiddos receive in their pediatric medical home. And that encompasses a lot of developmental screening work and developmental monitoring. And so I'm also the Louisiana, one of two actually, Louisiana Learn the Signs Act Early Ambassador. So I'm coming to you today in that role, but also I am a mom to two kiddos who have been through Part C early intervention as well as Part B. My 11-year-old still receives Part B services. So developmental monitoring and surveillance and screening and milestones and all the things is something that's really important to me in my professional role, as is my personal role as well. So I'm so glad to be able to share that with you guys today. Before we get started, I am curious if you could let me know in the chat, are any of you currently and actively using any of the Learn the Signs Act Early materials, maybe on a regular basis, here and there if it comes up and it's relevant, or maybe you've never even heard of it. So if you could let me know in the chat, that just kind of gives me a little bit of feedback. I'm hopeful that even if you are actively using some of our materials, that we will definitely talk about some things today that you may not have known, and we all can learn and hopefully elevate those services that we provide for our families. Okay, so just keep letting me know in the chat. It's helpful. I'll go back and look at that when I get done. So let me move my chat out of the way so I can see. All right, so today we are going to look to recognize that many children with developmental delays and disabilities are not identified as early as they could be, and some ways that we can make sure that we identify earlier. We want to understand the difference between that surveillance and monitor piece and screening. Look at how we can use those things together and improve identification for developmental delays. And then of course, learned how we can use the evidence-informed Learn the Signs Act Early materials for milestones to support that family-engaged surveillance and monitoring. And then I'm going to share with you guys the updates that we released in 2022 and the supporting evidence around those updates. Okay, there we go. So as we get started today, I want us to kind of collectively think, and you don't have to put this in the chat, but kind of think about what your circle of influence looks like for families who have young children. How are you connected, whether it's in your professional role or your personal life? What guidance or influence do you have with families? Are you directly interacting with families, maybe on some family-led activities? Are you perhaps working in a policy, procedure, administrative type roles? And maybe that that role really impacts a larger audience of families. And so as we're going through the presentation, I really encourage you to listen with the lens of how you can best use this information for the families that you personally serve. So how can you take this information and what are they going to be most excited about or most attracted to? What of these materials can you by next Tuesday, maybe not next Tuesday, next Friday, actively start using? And so really thinking with or listening with the intent to take action, okay? So why do we monitor child development? Developmental disabilities are common and they're often not identified before a child enters school. And so 1 in 6 children have a developmental disability, And they're even more common for children from low-income houses. So when you factor in that threshold, it's about 1 in 5 children who experience a developmental disability. And for autism, we're looking about 1 in 36 children, excuse me, are estimated to be on that autism spectrum scale. So we know that it's common, but we also monitor because it helps us as providers as well as caregivers know what skills are typical at what age and then what to expect next. And then it also helps us to understand when to act if there is a concern. If at all possible, we want to avoid that kind of wait and see mentality of, okay, well, maybe they're not reaching this milestone at this particular age. So let's just give it a few months and see what happens. We want to be able to identify as early as possible and provide that intervention, those resources and supports as early as possible. And also monitoring developmental milestones supports caregivers with their own advocacy. So we want families to feel empowered to speak about developmental milestones, to celebrate those developmental milestones, and have confidence when there is a concern, whether it is looking through our materials or looking through those checklists and determining that, or just a gut feeling they have. We want families, caregivers to feel empowered to speak to their provider and say, hey, I know this milestone is supposed to happen at 12 months. We're 14 months and I'm not seeing anything that is even getting close. I think we should look further into it. And so as we know, they're common, it becomes a significant public health issue. And unfortunately, so many children are not identified until they start school. And so what happens with that is they've missed out on so much time of that intervention, of that support, of those resources that they could have had that milestone delay been identified earlier. And so when it's not identified later, they've missed out on those opportunities. And we've also delayed and expanded that amount of time that it's going to take to get that kiddo back on track. For some reason, my slides are not consistently changing. So let's look at Louisiana children. So we mentioned earlier that about 1 in 6 kiddos have a developmental disability. However, in Louisiana, that is 1 in 4. So if you look at the charts on the screen, you can see in your far left that we are about 24% of children with a special health care needs in the state. And then on the right side, it talks about lifelong health conditions. So about 23.6% of our children currently have one lifelong health condition, and then 21% have 2 or more. So we know that those delays in disability are even more common when we are speaking about children specifically in Louisiana. So a little bit more about our children in Louisiana. Again, on the left, it is a show and a comparison of our Louisiana children versus United States. That second chart is the amount of children with a mental, emotional, developmental, behavioral problem from the ages of 3 to 7. So we're at about that 28%, again, higher than the national average. The next one is autism, higher than the national average. And of course, we probably all know that we have that higher rate of poverty, which is also that increasing risk factor. So I want to take a minute to talk about developmental delay versus disability. Those are terms that are often kind of used interchangeably, but they are a little bit different. So a delay is when a child is not meeting that expected milestone or behind in gaining a skill by a certain age. That delay can show up in the way the child moves or communicates, thinks, learns, or behaves with others. You may identify and be concerned about a delay if you notice that they're not developing skills at the same rate as other children. And delays can be short term. They can catch up quickly with intervention, but it also could be the first sign of a long-term disability or concern. And with disability, we're speaking to a more chronic challenge resulting from maybe a mental or physical impairment or both. Children with disabilities may find it difficult to engage in those daily activities, such as moving, learning, and communicating, typically beginning between birth or age 22, and that can last throughout a person's lifestyle. And although disabilities are lifelong outcomes, they can be significantly improved through early intervention. And so we're looking at really improving that expected outcome because of the disability through the intervention. So the delays are kind of webbed in between all of that. And so when you're working with professionals or sometimes maybe referring or working even with other professionals in our same space, sometimes we need to make sure that we're on the same page of what we're calling a delay or a disability so that we can make sure that we are providing that family and that child with the appropriate supports and resources that they need. So again, looking at and making sure with those terms that we are all on the same page of what we mean when we talk about surveillance and screening. So surveillance and monitoring is often used interchangeably, and it's speaking to the same thing. And that is that ongoing longitudinal look, monitoring of the child. With the surveillance or monitoring, there's no score or risk categories. And this is really intended to support screening. And there's 6 components that we use to describe surveillance. And so it is intended to elicit any concerns and really promote that conversation with families. It allows you to obtain a developmental history. It also allows you to have conversations and assess the strengths of the family. I love any conversation with families that are strengths-based. So even if we are discussing some risk or some challenges or concerns, there are always strengths to rely on and to have ready for that conversation. Of course, surveillance allows you to observe the child. You can do documentation, makes notes, and of course, sharing that. And remember, when we're talking about developmental surveillance and specifically Learn the Signs Act Early, it is always parent engaged, parent involved. We'd love for it to be parent led with just our support, but it is certainly parent engaged. And then screening has specific recommendations for the age that general development and autism screenings would take place. But you can always do additional screenings when a concern is identified, or maybe when a child is first entering your services or programs. The screening will have a score and will have some risk categories. However, the screening is not diagnostic. It is helping you to determine if that next step evaluation is needed. And it could be used, though, to qualify a child or family for services. And then I also want to share this image that I shamelessly borrowed / stole from our friends in Georgia, that lays out the difference between developmental monitoring, screening, and evaluation. And they've been able to use this with families to help them to understand the language. We find sometimes with families when they don't understand the language, that may cause them to shut down and to kind of withdraw and maybe not use those advocacy supports that they're hoping to see. And so this is a good way to help families understand the differences of these activities. And then this image is from Learn the Signs Act Early, but it's just a reminder of all the things that are happening around developmental milestones and having that surveillance at the top, and that reminder that it's parent engaged monitoring. We want to elicit conversations with families. We don't want it to be done without families. We want to do it together, to really make sure that we are, again, encouraging that advocacy, but making sure that we see a full picture of the child and everything that they are experiencing. So we use the term evidence-informed a lot, and there are publications and statements that support the need for ongoing monitoring and surveillance. And so I've got a QR code on the screen if you want to snap that, and that will lead you directly to this this article in the Pediatrics Journal supporting this surveillance and screening. So we've got to make sure that we continuously promote early intervention. We want to avoid that wait and see approach. There are many benefits to the earlier the better referral and connection. However, it is never too late to support services and supports. Any intervention is better than no intervention. And so we certainly don't want to, think, or we don't want families to feel as though they're close to starting school, so they'll just wait, or we'll just wait until the school system, we get there and we can talk to the teachers. We always want to promote the earlier the intervention, the better, but any intervention is better. All right, so let's dive into some developmental milestones. You guys are all probably familiar with what milestones are, but it is what most children can do by a certain age. So examples would be 2 months reacting to loud sounds, 9 months lifting up arms, 3 years drawing a circle. And one of the things I really love to talk about with milestones is sometimes families don't realize that some of the things that their kids are doing is something to celebrate, that it is a milestone that they have achieved by this age, that we want to be proud of and then know what's next so that we can look out for it. All children develop at their own pace. So there is certainly some variation in milestones, but most children typically reach milestones around the same age. And so all milestones are important. Milestones are foundational and they work in a continuum. So typically milestones are going to build on each other. So again, why it's so important to know what they are and to monitor that child is reaching the milestones. So we did a recent survey, not we, 0 to 3 did a recent survey and asked a little over 1,000 parents about what information were they seeking. And 70% of parents said that they were looking up information about developmental milestones. And I think that's so important for us to understand that parents are interested and they want to know. And for me personally, and I hope for you guys, I want to be a part of sharing that information and making sure that they're getting that evidence-informed and adequate information, and then knowing what to do if there is any concern. So the next few slides, we're going to talk about each domain and what that milestones may mean later in life. And so we're going to talk about social, emotional, language, cognitive, and movement/physical. So what does meeting a milestone in the early years mean for later outcomes with the child? And it's easy to find out what the child needs to do at 0 to 5. So what should they be doing at 2 months? What should they be doing at 6 months? But what is sometimes challenging for families is to understand what that even means. Why is it important to me? How will it impact my baby as they enter the school system or when they become a teenager and even an adult? And in my experience, I have found that explaining milestones to caregivers within the framework of what that may mean kind of later on helps them to really buy into the importance of developmental monitoring, because they can see how this will impact their child later on. And so first, and that's the framework that I put these next few slides in. So you may see something that helps you. Okay, well, we've talked about social emotional development before, but not necessarily in that framework. So this may kind of help with that a little bit. And so social emotional development is the ability to create and sustain milestones. And so we know that that is going to be important for children throughout their life. It helps them to express, manage, and recognize their own emotions, and then also be able to respond appropriately to others. It contributes to their sense of identity and belonging, which is so important to build that foundation for mental health. And then when we talk about language and communication, we're including the receptive language, which is that understanding, and that expressive language, which is their ability to convey that information. Typically, kiddos will develop that receptive language first. And so they will, if you say, go put this in the trash can, they'll be able to understand that and respond to that cue before they may be able to say that whole sentence in a way that you can understand it. When we have struggles with language and communication, that can lead to a lot of frustration for the child. So early on with behavioral tantrums, because they cannot convey and communicate what their wants and needs are. And then later on in life, that could lead to some bullying from their peers because they don't talk the same way as other children do. And guys, with language, it takes a while to make up those deficits and be able to sound and make the sounds for all of the ones that they are missing. And so that is a key early intervention that we need to address. And then language communication delays can also be associated with difficulty with reading, writing, learning, socializing. You think in the school system with spelling, if they don't say and hear the word the same way that is actually said and spelled, then that's going to lead to some deficits there. And then with cognitive delays, you may not see that full barrier until school age, but it could affect the way a child is able to play if there's some difficulty problem solving. And so there's a lot of games that, you've got to make decisions, you've got to solve a problem, and that could be difficult. It could impact just their situational awareness and understanding consequences, understanding how to make those decisions, taking care of their personal needs, and of course, impacting that attention level in the classroom if there are concerns or challenges of how they understand information. And then finally, physical movement. We know that, if there's a delay there, we can see it, maybe delays in walking, or having that muscular strength to crawl, things like that. But also those fine motor skills. Sometimes those are things that get missed. And that is a delay that contributes to later writing skills that may make it difficult for kiddos in the classroom, may require some adaptive resources and things like that to support that strength that they have in their hands. All right, so now what can we as providers use to support that parent engaged monitoring? So we are now entering Learn the Signs, Act Early. It is a program of the CDC, and the mission is to improve early identification of developmental delays and disabilities by promoting that monitoring and screening so children and families can get the services and the supports that they need. It's a health communication tool. It is evidence informed. It includes milestones that most children are expected to achieve. And the threshold for most with our Learn the Signs Act Early material is 75%. Again, we want to avoid that wait and see. And this approach allows to have those discussions, that in-depth surveillance, and it meets the needs of both parents and professionals when related to developmental monitoring. So I mentioned in our objectives that we would touch on milestones revised. So if you have used our materials in the past, it was revised in 2022 to incorporate feedback from 15 years where we had the original milestones in play. And so a few things that are different. In the new milestones, we include a 15 and 30-month checklist. So now all of our checklists match the recommended well-child visits. We eliminated some of the vague language that was incorporated in the first set with may and begins. And we took out, there was a section that had some warning signs. And what we were finding is that sometimes families or providers felt like we did not need to respond or act unless they fell into those warning signs. And that was not really the intention. We want to avoid that wait and see. And with the milestone revision process, it went through a very rigorous process where we looked at criteria, the literature was searched, we engaged lots of experts. If you can see on the screen, this is an example of several different resources they were used to ensure that it was informed. And we reviewed and spoke with many different trusted organizations and consulted with experts. We reworded things for clarity. We included things more around relational health and responsive parenting, and that's really thinking about that mental health component as well. And this is just an example of the different experts that were on the review team to make sure that it was inclusive of not only our high-level neurodevelopmental pediatricians, but as well as parents that are, they are receiving the information. So we want to make sure that everyone has that equitable representation at the table. So the biggest challenges when revising milestones and determining what milestones to include is normative data is difficult to find. When you go out there and you're doing the research, those references for typical development tables aren't cited a lot. And when they are, they kind of cite each other. So it's kind of difficult to find that data there, and it's often unpublished data. So, and even when it did exist, all the milestones didn't fit perfectly within a well child visit. And so, considering all the things, the result of the revision process gave us a 26% reduction in total milestones. So we went from 216 to 149. And a lot of that, it was because there were duplicates. And 60% of the milestones were retained from the original. Majority stayed the same. And the biggest thing to know if you have used the milestones in the past, those are still fine to use. If you have a bunch of copies or the booklets or whatever it is, the biggest difference, besides kind of the taking out the warning signs, changing out some language, the old version is based on a 50% percentile. So that tells you what 50% of children reach at that particular age. The milestone revision is based on 75%. So when you're using these milestones, you know that if that child is missing one milestone, 2, 3, 4, that is based on a 75% percentile. We've had, since the revision, we've had lots of high-level support from leaders in the field of development. And then again, we have a new publication in pediatrics. You can access it with that QR code. And this is just breaking out everything I said to explain the process, where the milestones came from, to really just know and feel comfortable that it is evidence informed, and it's a great thing to use for a guide. So let's look at it. So the milestone checklist, like I said, we have a checklist for each recommended well child visit. So beginning at 2 months, and it goes up to the age of 5. It provides early intervention information, developmental concerns, reminders, anticipatory guidance, what we love to see. So this is what a 12-month checklist would look like. On the left is the front side, and then on the right is the back side. So you can see those developmental domains and things that 75% of kiddos do by this age. I love these open-ended questions just to help families think about some other things that they may want to share with their doctor. Again, promoting that advocacy, you know your child best, and really helping to support. And then on the back side, these are your activities that you can do at this age to really help your child learn and grow, thinking about nutrition, thinking about baby proofing. So more things than just specific milestones, but kind of all things centered around that particular age. All of our milestones are family-friendly language, and it's at about 5th to 7th grade reading level. The milestones should be able to observe in a natural setting. It is available in multiple languages. I want to say 17 different languages at this point, and it is free and easily accessible. And I'll show you how to access it in just a little bit later. So the when to act early part, it was also in a separate list earlier, kind of those warning signs. And so it became kind of more subjective and things like that. And so they removed that because we kind of upped that threshold of 75%. And so that, combined with the open-ended question, should really give a good kind of understanding of, if we're missing any of these milestones, we may want to take that next step and look into services or ask for a screening. So we are fortunate in the state of Louisiana to have some customized checklists. And so again, You can use the QR code. You can grab that website. You can also just Google Louisiana Act Early map, and this picture of our state will come up, and you can click on your parish, and it will lead you to these checklists for each one of them, 2 months to 5 years old. And it at the bottom, when it says early intervention services for each parish, we have customized the name and phone number for that Part B and Part C services. So you don't have to go and look that up. You have that in each parish, your individual number that you can call. So these are only the customized checklists are only available on the Louisiana Act Early map. So we also have a milestone moment booklet available, and I'm going to again show you guys how to order all of these things in just a minute. This has all of the checklists, 2 months to 5 years in one little booklet. We also have an app that we'll look at. So this kind of covers both of your types of families. So if you want something physical in your hand, you can use this booklet, or if you want to use the app, I would have loved to have this booklet and always just had it in my purse to make notes, to record that height, weight, and just check the milestones. So I'm a big fan of this booklet. We also have an app that is a free app. Once families download the app, when you launch it, it does not take any additional data to do that. So when we look at the app, it has, beyond the checklist, it has a lot of information in it. On your left, there are videos built into the app. So if a family does not know what we are talking about when we say, or the checklist says a pincher grasp, you can look at the video to see that play out and know what to look for. It has, it kind of brings up if you are either make medium milestones or missing, some additional notes you can make. It gives reminders of when a well child visit isn't due, and you can go in and put that height and weight, make some notes, and then it also includes those important tips. So it's really got all things well child visit, all things development embedded into this app that parents can have available on their phone. We have these little postcards that come in packs of 200 that are free. And so if any of you guys attend any of the health fairs or anything like that, you can order these and be able to hand those out to your families. If you have, you give away maybe newborn packages, or have really anyone that's not on this call, if you want to share that with them, they work in a hospital or a doctor's office. These are great. They're free, and it helps us to promote that this app is available. We also have free books. We have a book for age 1, 2, and 3, and it tells a story as well as shows parents what developmental milestones are being met in that story. So that's a great time to engage. And then we also track what's happening in Louisiana. So right now we're about 5,700. This was in 2023. Pieces of material were ordered in Louisiana by many different entities. And we are currently tracking how many times the app is being launched. So in January, with our last data, we had 1,100 launches on the app. So we know it's being used, and we are going to continue to track as we spread this information and really get families even more engaged. Okay, so I'm going to stop sharing for just a second and pull up the website so we can see how to order. Okay, and if you guys have any questions, once I get done, I'm going to stay on and answer those. All right. Okay. So if you go to the Learn the Signs Act Early website, this is what you will pull up. It has milestones. It has different sections for families, healthcare providers, WIC, home visitors, all the things that you can look at, resources specifically to gear towards you. But if we want to get the materials, we're going to go to free materials. And so here is going to be the list of things that you can get. Some of them, like the checklist, you cannot order those already printed. Here is how you can click on them or printed. Reminder, if you go in this way, these will not be customized. Everything else will be the same, but it won't have the parish particular phone number. So let's look at the booklets if we want to order online. So if you go down here, it's going to have, these are the flyers, the booklets, the books, all the things that you can order. There are limits, and the limit is based on physical address. And so if, you know, you and your staff want to order separately a different physical address, it's kind of a way to get some additional ones. If you ever are in a situation that you need more than you can obtain, you can reach out to me and I can see if I can work a way to get you more material. And all of this is free, as a reminder. Okay, we'll stop share again. Let me pull my, okay. So I want to talk just for the last couple minutes, and then we'll see if we have some time for questions. Kind of what are we thinking in terms of practice change? What do we want to see with this information? I encourage all of you to think about your circle of influences and how you impact families, and think about your current process for developmental monitoring screening. I mean, surveillance and monitoring and screening, if that applies to you. So how is it happening? How is it promoted within families? How is it being discussed? How are you making a referral if a risk is identified? How are families getting things in their hand to support their own parent engaged developmental monitoring? And what they were receiving, is it the best materials to give? And then when you're thinking about if you're connecting families to additional supports and resources, knowing what those resources are, knowing their strengths, knowing the limitations, because ultimately, yes, it is important to refer, but that referral is only as good as that access and that family closing that loop and making the connection. And so we want to think about that from all different kind of sides. And so I have here just this piece of the law that tells us that it is our duty to identify these kiddos, right? We can't just sit back and wait for children and families to find us if that early intervention is needed, if they are not connected to anyone that's helping and supporting that developmental monitoring. So we've got to find those kids, and having these materials out at health fairs and really spreading that across the state is a way to do it. And then we have to refer if a risk is identified. This law tells us that referral should be made within no more than 2 working days after a child is identified. And so again, identify, referral, and what can we do to make sure that connection is made? There is a lot of research out there and publications that talk about how we can influence early intervention and that connection to early intervention. And so we're going to kind of speak to that for just a minute. And if you see on the screen, you see all the different things that are involved in that early intervention process. So we've got family factors going on. We've got services, limitations, or waiting list, you know, all of the things that we have to consider. I did a very, very small I don't even know if I would call it a study, but surveyed several families in one particular parish who were referred to early intervention, but did not connect with those services. And what I found was the biggest barrier for those families is needing a warm handoff. They were being referred without their involvement, or really barely an acknowledgement, maybe an acknowledgement, but not really understanding what they were acknowledging. And so when they got that follow-up call about services, they didn't feel comfortable. They didn't trust it. But so we really need that more explanation of, hey, you're going to get a call within this many days. And that's going to allow you to take the next step to engage in a screening or engage in support services. And then I really just wanted to kind of end with thinking about all of the things within the family factors that may impact that process of recognizing any risk or identifying an early intervention. And you see all these things that families have going on. If they are facing some big battles with their financial situation, maybe they don't feel like the need is great. Maybe they have a history of developmental disabilities, and this one doesn't feel as big, and so they don't seek out services. They don't have time. They're not confident, and so there's many things that impact it. And I want to encourage you guys as providers to really think about all those things, and knowing, the big pieces of importance are, identifying and encouraging families to monitor the development, act early if a risk is identified, and then making sure that connection happens. All of this parent involved, all of this parent engaged, to really make sure that we are supporting the children and families of Louisiana the best that we can, and using Learn the Signs, Act Early as a resource to do that. And here's my information. Again, here are the websites that go directly to Learn the Signs, Act Early, that go to the customized versions. Here's my email. You're welcome to reach out. If you have staff or other organizations that you would like for me to do a presentation for, I can certainly do that and support you in that work. Just reach out. And I think that we're going to have a few minutes available for questions. I don't know, Monica, if they unmute or put in the chat.
Yes, we're gonna use the let's use the chat and the Q&A, whatever you're more comfortable with, if you have any questions. And if necessary, we can always unmute, but we'll start out with the Q&A. If you're like me though, I really don't like, we have a lot of people on, so we don't want it to be out of control, so I can't just let everybody be unmuted. But if you're like me, sometimes I have a hard time typing in the little chat. So you can do either. If you want to type in the chat, will you unmute me so I ask you a question? That's fine too. Just whatever is more easy for anybody.
Brandy's asking if the slides will be sent. Monica, is that something that is typically done?
No, because we're going to have the presentation is going to be recorded. So we'll have there's a recorded copy of the presentation. So Clarence Williams did raise their hand. Let me see here, and I will see if I can, oh, here it is. I am going to unmute here. We're gonna take a chance. Oh, there we go. Okay. Do I have Clarence on? I think so.
Raised hand by mistake.
Oh, okay.
And if there is, this is one of my big presentations. And so if there is a need for a smaller slides show that you just kind of want the high level information on. If anybody wants to reach out to me so that you have it, all the information together, I'll be glad to do that for you.
Just give everybody a little second here. Everybody's saying, thank you. It is, and I will say, because you were talking about the materials, and you asked earlier to begin with, I do use the materials often, and I will be using some of it this weekend at a little carnival, like the Gingerbread House is one of our advocacy centers for children, and so they're having a little carnival, and I'm going to be using that and developmental wheels, because we have developmental wheels with early steps. They're for that event. But I always use the rack cards. I don't know if they have the current ones with the current milestones, but I still use the other ones because they have English and Spanish. So that's always really good to have whenever I go out anywhere, and I've carried those for years. So, but then also having there's also a growth chart, things like that. So there's things that parents can take.
Yeah, and I'll stay on for a few minutes if anyone, thinks of something and wants to put it in the chat. But another thing too, if you guys are out there and you realize that there is a need for a certain piece of material or done in a certain way, or maybe this one didn't work because you wish it also had this, I'd be glad to take that feedback. It may be something that I can personally do for Louisiana. But also the CDC is really good about hearing feedback from both providers and families so that they can make sure that what they're providing is the most useful. So just reach out and let me know.
Gotta unmute. I think we're spot on. We're doing great on time. So yeah, if you can just watch, because I'm going to be totally preoccupied now. As I start my start. So if you can just watch the chat or the questions, if anything comes up, until you're ready to get off. Thank you so much for being here today. And I know the last time we had this presentation, a lot of the providers really appreciated the information. So I'm going to go ahead. It's going to take me a second to transition to my presentation. So give me a second. No. It's not working right. Hold on. Of course, we practice this. I'm sorry, I gotta have my notes. I know y'all don't want me displaying it all. Let's see. As I'm trying to do this also, I will go ahead and talk about how much I appreciate the variety of people that we have on today, because we have, I see a lot of early intervention providers, a lot of early steps people, but then there's also a lot of people that I've worked with off and on. Oh, it's showing my screen's loading. Can you tell how that looks, Stacy?
You're good.
Okay, great. Okay. I hate being blind, not being able to tell what's on here.
See,
So,
real quick before you start, see if you can dismiss that last question.
Okay.
So that I can watch that. It's saying that you were going to respond. So there you go.
Okay, good.
We're good.
Okay, good. Yeah, I know. So we have to have our ducks in a row here. So, but I was saying there's a lot of people, and this is why I think it's important that we're doing this, the history of families helping families, because and I know that Patty is on here today, and her favorite phrase that she uses is that there's so many people that don't know about families helping families, and that they need to know, especially people that are involved with early childhood, people that are involved with individuals who work with individuals with disabilities and all that. So This is, we just kind of want to try to explain to y'all and tell y'all and give you more information exactly what Families Helping Families does. Hopefully you've heard of us and now you'll know, you'll know what we do and why you need to refer to us. So we're going to start out with the history of Families Helping Families. And it really kind of all started with Act 378. So you may or may not have heard of Act 378. It's or the services, the community and family support system is what it is. You may just be familiar with some of the services that are included, like y'all hear about the waiver. Some of those services or how they originated and why this came about. And it actually was from parents and self-advocates. So that's important because that's a lot of what we do at Families Helping Families. I'm going to share the history of Act 378 and the community and family support system and what services are included in that. The Families Helping Family Centers were created as a result of Act 378, and that was in 1989. So we're going to go ahead and start. We can't really talk about Act 378 without talking about our waivers, Medicaid waivers, the home community family support system without talking about Families Helping Families. So let's see. So it kind of, like I said, it started in 1988. That's quite a while. In 1988, it was an institutional system, and like services were either residential or facility based for individuals who had disabilities. And so over the past 30 years, it really has drastically changed. Prior to 1988, Louisiana had few services for families who wanted their child with disabilities to grow up in their own home. And families with adults with severe disabilities who wanted to live on their own, like in their own home, there were basically no support for them. The only services that were available for people with disabilities were residential or facility based. So, going to an institution. The state, what they did was they would build a program and then put that person into that program, whether it fit that person's needs or not. So when this happened, a person would be required to attend that program or worse, be forced to live there in order to receive any kind of services. At one time, Louisiana had 9 developmental centers and thousands of community homes, private institutions, and sheltered workshops. So also, Stacy, I'm seeing several things in the chat. I'm just want to make sure that those are being addressed because I can't see what they are.
Yes, you're fine.
Good. In 1988, there was a DD Council conference, and I'm calling myself out here because DD Council, we need to do these acronyms. Like I said before, if we say an acronym and you don't know what it is, please speak up. So DD Council is the Developmental Disabilities. And for Louisiana, it is the Louisiana Developmental Disability Council. In 1988, that's when everything really started to change. The DD Council sponsored a conference on community integration, where they had parents and professionals, and they heard how other states were providing individual and family supports to the children and adults with severe disabilities in their own homes. So they were looking at other states to see what they were doing. States like Michigan had the philosophy of whatever it takes. So they thought whatever it takes to support a family of a child with a disability in order to keep them in their home and keep them out of an institution. So supports would be provided to that family to allow that to not happen, like to prevent them being institutionalized. Also, Colorado had similar supports for their adults with severe disabilities, and this allowed them to live in their own homes with their own families out in the community. So these conference presenters from the other states, from Colorado and Michigan, they really inspired the people of Louisiana to think, why not here? And it made them think, like if this could happen in other states, why can't we do this in Louisiana? So the conference, participants were asked to express their visions of a perfect world for people with disabilities and their family. At the end of the conference, they were asked to dream big, like what is your what's your Christmas list? Like, don't leave anything out. You know, what would it look like in a perfect world for your family member with a disability in Louisiana? So people said much of what they had heard from the presenters from Colorado and Michigan, like being able to keep their kids at home with family supports and individuals with disabilities living out in the community as contributing valued members of society, having jobs, living and playing and doing everything else that somebody else their age or regularly abled peers would be doing. So all of these ideas, they put them on those little flip charts. You know, you put little sticky notes or you tape it up on the little flip chart, and they were taped to the walls and in a huge Sharpie so everybody could see them. And that's when they started to have like a brainstorming session. So at the end of the session, when everybody was about to leave, after they had everything up and like, this is what we want, this is high in the sky, this is what we want. It was actually a parent from Shreveport asked, his name's Mike Vasco. He asked, so now that we have all this stuff on the wall, and we've got all these great ideas, are we just going to leave them up on the wall? Or are we going to actually do something about them? So that was a great question. So the group agreed that there was no reason why they couldn't find a way, or at least put into motion a way to make all of those things that they wanted to have happen. And so that's what they set out to do. So the community and family support movement. The Developmental Disabilities Council, they accepted the challenge and the community and family support movement was born. The council formed a steering committee, and that was made up of parents, self-advocates, and other advocacy groups, and set its goal to create this system, this community and family support system. And they really felt when they set out, they felt that it was this is how it's going to be accomplished. We need to get legislation. So they said that it'd be accomplished through legislation the following year. So where are we? We're 1988, so 1989. And the committee, the steering committee that they formed, before they like actually went for the legislation, what they did was they had public forums and they held meetings around the state, like statewide, so that they could get input from parents and self-advocates on their vision statements, and they really wanted to help build support for the movement. Also, I know LCAN was created to pass Act 378. So LCAN is Louisiana Citizens Action Network. They change it, so I should know better. But LCAN is very active now, and you see them now. We'll probably talk about this more about. They do send out action alerts and encourage people to advocate for their items that are on their agenda. So Act 378 was actually passed in 1989, and it had unanimous legislative support. The act, it called for a plan to implement a system of community and family support for people with developmental disabilities. It also directed the Developmental Disabilities Council, the DD Council, to write the plan based on their guiding principles included in the act, as well as listing an array of community and family supports to be made available to families and adults with disabilities. So they're looking at the guiding principles, and really those guiding principles, they got those from that meeting, from the conference, from those public forums, from the individuals themselves, the caregivers and the self-advocates. So the last thing they did, though, was they directed the state to implement the plan and for the council to oversee that implementation. Oh, and what that was, I just witnessed that yesterday because they actually have an Act 378 committee. So when you see announcements or public notice of any kind of Louisiana Developmental and Disability Council meetings, they usually have their committee meetings as well. And the public is able to attend. Yeah, not necessarily participate, but they can definitely attend. And so they have an Act 378 committee, and a lot of what they're doing is they're reporting on, everything involved with Act 378. So it's very interesting. And I always, every time I sit on a committee or sit on in, because I don't participate, I'm ears only, but it kind of makes me think of all of this. Like, this is where it started, and this is where we are today, and this is happening, and it's also posted on YouTube. So, okay, so the council formed the advisory group to assist in writing the plan. They held public forums across the state to get input into what should be included. So if you'll notice, like every step of the way, there's been input. That's very significant. After 2 years, the legislature approved the plan and provided the first funding in 1991. So it took from 1988 when they had the idea, the seed, and then it was actually funded and started in 1991. The Developmental Disability Councils in LeCan have sought additional funding every year since. So this is important because we're still seeking additional funding. Hundreds of millions of dollars, especially for families helping families. Hundreds of millions of dollars annually are appropriated to the community and family support services. And the DD Council continues to oversee that implementation. So that, therefore, what I was talking about earlier, the Act 378 committee is like the reports and the kind of like the advisory for that. So thousands and thousands of individuals with disabilities, their families have received services in their own home over the past 33 years because of Act 378, including myself. Some of the services included in the community and family support system are the Individual and Family Support Program, the Flexible Family Fund Program, waiver services, Families Helping Families. Yes, the Families Helping Family Centers are a part of that community and family support system. So we were, I think this is, I'm kind of skipping. We actually did practice, but I'm skipping ahead because I don't want to get too far and leave out Stacy. So part of the council hosted the public forums and got input from families and created Families Helping Families. So many parents asked for kind of like number one, it had to be family friendly and like a one-stop shop. They wanted a place that they could go to for information and services that, might cover like their individual disabilities, or information on resources in the area. We're going to go into that a little later, but of like all the services or all the supports that we have. So the DD Council, since parents were asking for family friendly, they answered the request by providing the federal funding for the creation of the Families Helping Families centers. And I will say, Families Helping Families is statewide. I don't think that's said at this point. So there are centers that are across the state, and Stacy will go through some of those. The federally funded Parent Training and Information Center and the program that is now called Early Steps contributed some of the first staff for the centers. And I've definitely heard about that, being an Early Steps community outreach specialist myself. So after they funded the centers, for almost 10 years, the council secured a state appropriation from the legislator to replace the federal funds with state dollars and continue to contract with 9 centers today. So, one time that was federal funds and now they're state funds. Since Families Helping Family Centers were created as a part of the system, the community and family support system, it's only natural that they operate under and adhere to the guiding principles that were included in Act 378. Therefore, it's important that as providers, you understand these guiding principles as well. So I'm going to go through a few of these. And that's what I'm saying. These are like what we feel. This is like what we do. Our daily work are based on these principles. So one of the guiding principles says that children, regardless of the severity of their disability, they need families and enduring relationships with adults in a nurturing home environment. As with all children, children with developmental disabilities need families and family relationships to develop to their fullest potential. We just talked about developmental disabilities, and that's kind of Act 378 is we're talking about disabilities, primarily developmental disabilities. And I know Julie went over that a little earlier, talking about, what's the difference between a developmental disability and a developmental delay. And I don't think we have anything on here that actually, at least prior, that kind of says that, but Julie did say. So a developmental disability is lifelong, and there are several areas of ability development that's impacted, and it is before the age of 22. So that's important to know that the onset happens before the age of 22. So if you have an individual that's maybe 24 years old and is in a car wreck or has a traumatic brain injury, that is not considered a developmental disability or they would not fall under that category because it happened after the age of 22. If you have a 17-year-old that was in an accident and had a traumatic brain injury, then yes, they would be eligible for developmental disability programs because it happened before the age of 22. So it has to be documented and known that it can happen. So that's the first guiding principle there, is that like enduring relationships, they need to be with their families. They need to be in their natural environment, not in some kind of like Lysol smelling institution. They need to be with other children, maybe their siblings or their cousins, or, with other children and out in the community. So that's the first principle. The second one, kind of dragging here. Adults with developmental disabilities should be afforded the opportunity to make decisions for themselves and to live in typical homes and communities where they can exercise their full rights and responsibilities as citizens. And I will say, all of these pictures on here are our families. They're our families. They're individuals that we work with. They're caretakers. There's a lot of good times on here. So some of these pictures are self-advocates. They're adults. It's an adult group called Hanging with Friends, and you'll notice they have their own little shirts, but they're called Hanging with Friends. That's one thing that we do with Families Helping Families. I just want to point that out. Love that. I'm skipping here. Okay. So these are more guiding principles. So another guiding principle says that services to persons with developmental disabilities should be responsive to the need of the individuals and their families rather than fitting people into existing programs. So don't fit a square peg into a round hole. We build the supports for the person. We don't stick the person into a support that maybe doesn't even work or doesn't even help them. So that's very important to know. That's another principle. It says that adults with developmental disabilities should receive the supports necessary to enable them to achieve their maximum potential through increased independence, productivity, and integration into the community. And there are so many programs out there that can help and work with those. And I know a lot of people don't necessarily know about those type of things. And that's what Families Helping Families is. The family support system shall be flexible, individualized, and family-centered. The needs of the entire family shall be considered in the development of the individualized family supports. So when you're talking about providing supports or services for the families, you do take a look at, like, what do they have now? What kind of natural supports do they already have? And then what do we need to help them to go back where we go back to that full potential, to get to that totally 100% independent full potential, working out in the community, you know, so they take a look what's needed to do that. The family support system recognizes that families are best able to determine their own needs rather than having their needs determined by the state or an agency, which, yeah, everybody needs to, especially when it comes personally, I want you to listen to me. I don't want you to tell me what you want me to have. I want to tell you what I want to have. And I can tell you that's pretty much, as my kids have gotten older and they're young adults now, that's pretty much how they say too. They want to tell you what, they don't want to listen to what you had to say. So, but that's true. And that's what Families Helping Families also, you know, that's what we value, our families. And we try to support, we understand that every family is unique, every individual with a disability is unique, and that everybody may have different needs or different wants also. So I don't know how much we talked about wants, but that has a lot to do with it. I'm skipping, I'm sorry. Okay. There's a lot of guiding principles, but that's good. So the system shall have a program of outreach so that families may obtain family support at the time they learn of their child's disability, and so that people are aware of the availability of community supports when the need arises. So a very good example of this, I know I'm kind of skipping ahead and maybe even doing some of Stacy's presentation, but a good example of this program of outreach. So since I'm the Early Steps Community Outreach Specialist, then with that, you know, I go out and I network, or I go visit some of our local hospitals. And we so happen to have one of our local hospitals that has a caseworker, case manager, social worker, and she calls often. Well, often, you know, she knows if there's something that, especially if it's a family that she knows that we are working with, then she'll call and ask a question. And that's what we want. We try to go out there and get out in the community and network with other agencies, and go to those hospitals and clinics, and go to the events that are happening, and just outreach to the community and to professionals and providers, and let them know that that's the whole point of what we're doing today and why I'm doing this right now. We want y'all to know what we do. And I hate to say it, how valuable we can be to families. And we'll go on to that. But so this program of outreach. And finally, we have the system shall support and strengthen existing informal social networks and natural supports in addition to professional support services. The system shall promote the use of existing community resources. So just kind of what I was saying, you know, we work with community partners. We are a part of the system. We are not the system. We're not the man. That would be the DD Council, but we are a part of that. We're a part of the Act 378 as far as Families Helping Families go. So we do get out there. We work with other community programs. We always say, if you have something that you think our families could benefit for, we want to know. We want you to reach out to us and contact us. So that's the final guiding principle, and pretty much all I have right now to say about Act 378. I'm going to go ahead and I'm going to mute it and take a drink and turn it over to Stacy.
All right, thank you so much, Monica. So now that we have a better understanding of Act 378 and its guiding principles, we're going to talk a little more about the network of Families Helping Family Centers. As Monica mentioned, there's a network of 10 Families Helping Families resource centers across the state. That's 10 independent 501c3 nonprofit agencies with their own board of directors. That's family directed. And that's really the key to what we do here is that we're family directed. So we are parents or family members of children or adults with disabilities. And I share frequently that when my son was diagnosed, I understood his disability and I knew providers or physicians to take him to for those typical things. But I joked all the time that I had to live forever because I had no idea about a resource that existed outside of what we had with his pediatrician. So I used to kid that I would have to take him to the nursing home with me. And while I used sarcasm to kind of defuse stressful situations in my life, that was really something that I was concerned about because I did think that I needed to live as long as I could for him. And we so often hear parents say that I would rather my adult child with a disability pass before me because they don't know of services that exist outside of what they're able to provide from home. So we dig in there and find out what resources are available. And we share our own personal experiences, which is the importance of that family direction. We've learned what we've had to connect with through our children's disabilities, and then we take that and we turn it around and we share it with the families that we talk to. So we promote advocacy through empowerment. We take what we know, we teach others to know that as well, so that they can be empowered to deal with their child or adult child's disability. We're a one-stop shop for disability information and support. We're going to find out as much as we can, stay as up to date as we can, and connect with all the resources through professional developments. We see so many of you all that are friends with us through the work that we do listed on our participant list. And we make ourselves familiar with what you know so that we can turn around, provide that information to the families that we serve. We serve all disabilities and special health care needs. So it can be a learning disability, it can be a developmental disability, or it can be a child who has a special health care need. And we're going to make ourselves familiar with the resources and the providers that are available for that particular disability or illness, and in turn share that with our families. We have an unwavering belief that individuals with disabilities deserve a meaningful life in the community. So like I mentioned, the majority of our board members and our staff are parents of children with disabilities. We are relatives of individuals with disabilities, are individuals with disabilities ourselves. So we have self-advocates who take their experience, their lived experience with their disability and are able to serve other families. And we're people that care about individuals with disabilities. It's who we are, it's what we do. So we provide 3 core services to individuals with disabilities: parents, family members, professionals, and service providers. All 10 Families Helping Families centers provide information, resource, outreach, peer-to-peer support, and education and training. In addition to these 3 core programs, each center offers programs and activities that are unique to their own centers. And you'll learn more about that as we move on in the training. So what is peer-to-peer support? Peer-to-peer support is the #1 reason families connect to Families Helping Families. When children are diagnosed with a disability or special health care need, the news is typically delivered by a medical professional with a lot of the acronyms and jargon that we talked about earlier. And those professionals will often assume that families know what those diagnostic terms are, and they don't think about the impact that news is going to have on the family. Parents may leave the medical facility feeling hopeless and confused. And another thing that I share typically is that I sat in my car after the appointment and cried and felt stupid because I nodded my head when an acronym was said or terminology was used that I didn't understand, because I felt embarrassed to admit that I didn't understand because they spoke to me like I was supposed to understand. And so that's the first thing that we're going to do, is remove that barrier and tell families it's okay to not know. And that's why parents want to speak to other parents that have experienced the same thing or have had a similar diagnosis, or can admit that they sat in their car in the parking lot and cried after an appointment, because it's that personal connection that allows us to be able to find what's going to help that family the best. They want somebody that can give real expectations and real examples and be honest and truthful. One of the hardest parts of our job sometimes, especially for the state of Louisiana, is to admit that we don't always have the resources that other states have. We're not as far along in that journey as a state, as other places are, and can't offer as many services or supports. We don't, unfortunately, have a wealth of things for children who have kids with autism. There are not a lot of support groups, and we're all familiar with that living in the state of Louisiana. So we're not going to lie to a family and say, here's 15 different things that you can choose from that are extracurricular activities for your child with autism, because there aren't. So we're going to tell them, here's what there really is. So they want real-time examples, and they want real expectations, and they want you to be truthful. They need you to be genuine and caring and support them as they walk through the challenges that they face. So everyone on our staff that provides peer-to-peer support are either parents of children with disabilities, family members, or individuals with disabilities. And we focus on the ability, the child's strength, and not the weakness. I encourage our school professionals during an IEP, if they don't already, to list some strengths for that family before they start into an IEP meeting. Because when you're raising a child with a special healthcare need or a disability, conversations often start with what their inabilities are. And we've learned from our experience as parents and our experience as professionals working with all the wonderful people that we work with, that they have so many abilities and touch your life in a way that you never imagined possible, because there's a pureness in an adult living with a disability, and there's more living in the moment and appreciation than I think we sometimes recognize. And so we never want to focus when someone calls on what that child can or cannot do. We want to talk about what the strengths are, and then what we can share with them and how we can help connect them so that they can find the resources that they need to continue to promote those strengths and not be stuck in a place where they're not living the best that they can. Our one-to-one support that we have isn't just for families, though. We get calls from professionals. Like I said, I see a lot of names that we're familiar with, and I know we've worked with a lot of you all. Nothing means more to us than when one of you will stop because you've encountered a family and you remember something in a conversation with us or a training with us, and know that you should ask a question because it might better help you serve your family, or you recommend to a family that they reach out to us. I spent 6 hours with the walk-in client yesterday, and I don't typically spend almost an entire day with someone, but after a couple of hours, it came up in our conversation that she was on the phone with a friend who was in Books A Million, who she was sharing her struggle with, who met a social worker just minutes before, and then she went and tracked the social worker down. And the social worker wrote our name and phone number down and said, these are the people that can help you with your problem. And so somebody remembered that they knew about us and they knew what we did and they knew we worked with disabilities, and they were able to send that, it was a sister to me so that I could help her with her sister and her disability. And so that always impacts us when you all recognize that it's meaningful to the families that you serve. Last year as a network with our 10 Families Helping Families centers, we collectively provided peer-to-peer support. And when we say peer-to-peer, that's a family member supporting another family member. So we will make connections with families. If I know that someone has a newly diagnosed child with autism, my son's 25, so things have changed and they aren't handled the same way as they were when he received his diagnosis. So I can't really give a lived experience as to what's available right now or what challenges you might face in the education system. What's the best way to interact with your provider or pediatrician? So I really need to connect them with another parent who has a child of a similar age or maybe a few years older who has had a more recent similar experience. And so I'll ask that family that we worked with previously, if I can share their information with the new family that we're working with. So that's a peer-to-peer connection, and that's us providing peer-to-peer support to a family that we serve. So last year, between the 10 Families Helping Family Centers across the state, we provided peer-to-peer support 30,300 times. And we just gathered all this information, and we're kind of blown away at some of the numbers that you're going to be hearing. So I want y'all to keep that in mind when you hear me mention some statistics about what the centers are going to or have been providing, because I have a little story to tell you as we get further in the training. So like I said, we believe that knowledge is power, and we believe it's important to provide individuals with every opportunity that we can to build their knowledge bank. Each Families Helping Families Center offers education and training to parents and professionals. Many don't realize it, but half of the individuals that attend our trainings are professionals. This includes school staff, school level district staff, medical providers, related service providers, case management, and others. Individuals have the opportunity to attend virtual trainings in real time or watch archived versions. Our topics include early intervention, special education, transitioning to adulthood, Section 504, Act 378 that you just heard about, disability-specific, health-related, Social Security, Medicaid, special needs trust, bullying prevention, and so much more. You'll get some information as we move on about how to connect to the other Families Helping Family Centers. And I encourage you all to find their social media, their Facebook pages, and follow, because you'll get real up-to-date information on what trainings that they're going to have available. And we attend each other's because we need to be updated a little bit on a current topic. And so you're always welcome to join any center's training if you want more information on a particular topic. Most of our trainings are 1 hour in length, unless it's a special presentation like what we're doing today, and are presented by our staff, like myself or Monica from Region 7, or a community partner like Julie, who you heard early, who we deem to be an expert on a particular topic. In addition to doing our own trainings, we are frequently requested to present at other regional and statewide conferences. Last year, collectively, all the Families Helping Families Centers conducted 365 trainings. That's one training per day out of 10 centers, which we're really proud of. And we did that on various disability-related topics, and over 5,500 individuals attended those trainings. Information and resources go hand in hand with education and training and building knowledge. Families and professionals need access to relevant, up-to-date information and resources to assist them in building their own knowledge, which they can then use to make important decisions. Additionally, each center publishes a newsletter with upcoming activities, trainings, and relevant topics of interest to families. Last year, Families Helping Families Centers distributed over 141,000 copies of newsletters full of valuable information. Again, you can find a way to get those newsletters on the social media pages, but you can also go to their websites and connect with each center and receive those newsletters. Some are sent out monthly, quarterly, semi-annually, but they're a wealth of information that would better help you all as professionals serve the families that you do. Each center also has a website that provides relevant information about their center and offers additional resources. Last year, Families Helping Families Centers had 210,000 website visitors. Outreach is how we connect with individuals. Many parents are referred to us by another parent, but some parents find out about us through our outreach efforts. We continuously look for new ways to connect with individuals while continuing to provide outreach as done previously. Outreach has traditionally been done in person at community events, resource fairs, health fairs. Additionally, we do a lot of outreach through our multiple social media channels. And collectively, as a network, we have almost 50,000 fans on our social media networks, and we've had over 1 million reaches across our social media platforms. So Operating a nonprofit organization is just as expensive as operating a for-profit organization. Unfortunately, not everyone understands this fact. We all have offices that have rent or mortgage payments. We have utilities, phones, copy machines, postage, technology, audit fees, our favorite, liability insurance, and more. Our greatest assets are our uniquely qualified staff. In order to keep our staff and continue to provide the support and services we do, we have to have funding. All the Families Helping Families centers receive funding from the Louisiana Department of Education, from the Bureau of Family Health. 9 of the 10 centers receive funding from the Louisiana Developmental Disabilities Council and from human service authorities and districts. Additional funders for some centers include funding from Early Steps with the Louisiana Department of Health, the Office of Special Education Programs and Rehabilitation Services Administration with the U.S. Department of Education. That one's a mouthful. And from Health Resources and Services Administration, Office of Behavioral Health. And finally, most centers receive individual donations and community and foundation grants. So to recap our collective successes for the 21-22 fiscal year, we connected with families, professionals, and youth over 39,400 times. We provided 365 training opportunities. Over 141,000 copies of our newsletter was distributed, and we had almost 210,000 website visitors, and more than 49,800 individuals follow us on at least one of our social media platforms. And here's a map of all the 10 center regions in Louisiana and the areas that they cover. You'll see at the top of your map, you have Region 7 on your left and Region 8 on your right, and that's the 2 regions that you're with today. Next, we have the addresses and phone numbers and email addresses of all the Families Helping Families centers. Monica's going to be dropping a resource down so that you can get all that information before we end today. And now we're going to dive into the parishes and services that are unique to the Families Helping Families of Region 7. Families Helping Families Region 7 serves Bienville, Caddo, DeSoto, Red River, Webster, Bossier, Claiborne, Natchitoches, and Sabine parishes. They have a contract with Northwest Louisiana Human Services District. They have a lending library, a parent support group, a hope closet, hanging with friends socialization group, Be Kind campaign, Region 7 resource guide, an annual Christmas party, and a spring fling picnic. Families Helping Families Region 7, it's who we are, it's what we do. They provide information and resources, gaining relationships with community partners through outreach to provide families a direct contact for their needed resources, lending library and quarterly newsletter to keep our families well informed, educational support to help parents learn about parent rights and empower parents to become effective advocates, advocate for special education, anyone with a special healthcare need, and legislative policies. Their Hope Closet, which provides diapers, clothes, formula, and other essentials that are given free to families in need when available. Early Steps for children 0 to 3 years who may have a developmental delay provides families of children who are receiving early step services with the information, training, and support they need to become an active participant in the delivery of early step services to their children. Support groups, they have a monthly parent support group to share experiences and provide support in a stress-free environment. And Hanging with Friends group is a self-advocate group for individuals 18 and over looking to socialize and make friends. And Education and Training offer workshops and webinars on a variety of disability topics to educate, encourage, and empower. Topics are family-driven, timely, and relevant. Now we're going to hear from one of the families served by Region 7.
I'm going to take it off mute too, because I need to talk about this. I just wanted to say that this is one of our parents and from the parent support group. And I always tell families when I'm talking to a new family, I tell them about my family support group. We meet once a month and we usually go to different restaurants. We do have some dads participate. It's mostly moms, caregivers. It could be grandmas, aunts. It is mostly female caregivers. So I say it's like a mom's night out or a girls' night out. It's always really fun. But I also say this is Antoinette and her daughter Carrington, and she made this video for us to try to help explain some of the services with Families Helping Families. But that is the best way that somebody can find out about the services that are available to them or the supports that may be available to them is by talking to other parents. Attending the parent support group gives you more than one view. So yes, one-on-one peer support, which Families Helping Families offers, and we do a lot of, yes, that's beneficial. But when you can see what 3 different parents each do in their own homes or some of the challenges or barriers or strategies that they've used or what are their tricks, you can learn so much from another parent. So I'm going to go ahead and play this now, but I just wanted to add that to this conversation because I love my parent support group and I need it myself sometimes. So I will go ahead and play.
Hi, my name is Antoinette, and this is my daughter Carrington. And today we're going to be talking about Family Helping Families Region 7. We have been acquainted with this organization going on almost 4 years now. The staff is relatable because many of them understand the needs and challenges of having a loved one with a disability. They have helped with answering questions about things that I've had, such as home care and schooling. Family Helping Family goes above and beyond with help finding resources. One of the resources includes the Parent Support Group. This is a group that meets once a month, nightly, and we have dinner together. And it's just a great time. As parents, we get together, we just unwind, we talk about things. It's good to have a conversation with other parents with kids with disabilities, just to listen at the things that they're going through, just taking notes about different things. And another resource is online resources, such as webinars. And some topics with the webinars include IEPs and special needs trusts. Family Helping Families Region 7 has a great Facebook page. And on this Facebook page, they share things that's going on in the community. They have different topics that they share as well from other organizations in the Arklatex and just the surrounding areas. Family Helping Families also has a newsletter. And in this newsletter, it talks about the laws for the state of Louisiana dealing with individuals with disabilities. There are many activities that Family Helping Families has for individuals with disabilities. For the adults, they have Hanging with Friends. And for all ages of individuals with disabilities, they have Christmas parties, they have the Shreveport Mudbug games, and they have movie nights. And Carrington, which has been your favorite event that Family Helping Families Region 7
Christmas
has?
parties.
Christmas parties? Why Christmas parties?
Snacks, movies, pajamas, desserts, and pizza.
Snacks, movies, pajamas, desserts, and pizzas. That's why you like that. Okay? Good answer. All right. Family Helping Families Region 7 is a great resource for us, and I know it will be for you as well.
That was great. Snacks and pajamas are my favorite too.
And I promise you, I when I asked Antoinette if she would make this video, I did not tell her what to put. I didn't want to make her feel obligated to say anything. And so I said, just do what you think. And so this is a result. I promise you, I did not write a script, but she could have done this presentation herself.
She did great. We need this as a television commercial for all of our centers.
Yeah.
So now we're going to dive into the parishes and services that are unique to Families Helping Families Region 8. And you heard me mention what we've accomplished across the state as the 10 Families Helping Families centers. So I wanted just to mention that Families Helping Families Region 8 started by our previous director, Alicia Banks, in a broom closet at the ULM library. So anytime I see the success of what our agencies have done, and the impact that we're having on families across the state with 365 trainings in the last year. It makes me proud to know that we came so far. Alicia is an amazing woman and took this organization and brought it up off the ground from a broom closet at ULM to the agency that we have now. Families Helping Families Region 8 serves 12 parishes in Northeast Louisiana: Caldwell, Franklin, Lincoln, Morehouse, Richland, Union, East Carroll, Jackson, Madison, Washita, Tensas, and West Carroll. We have a contract for the Northeast Delta Human Services Authority. We also have a lending library. We have Friday Focused, which is an adult opportunity group that meets monthly, doing activities either here in the office that are fun or sometimes educational, or out in the community, going to movies or bowling or to the park or to the zoo. We try to come up with something that's fun and exciting for them. Bowling seems to be number one on their list, but they always enjoy the opportunity to get together. We also have the Adult Opportunity Book Club, an annual Christmas open house that's open to the public, the Touch a Truck and Trick or Treat event, and People First. For the first time last year, we also started a Christmas party for our Adult Opportunity group, and recently just had an Easter egg hunt for that group as well, and are hoping to sustain those programs as we move into the future. So how can you help the Families Helping Families network of organizations? The very first thing is to make a referral to our organization. FHF can be one of the best tools that you have in your resource arsenal for children, families, and adults with disabilities, learning delays, or special healthcare needs that you have. If you make that referral to us, we're going to make sure to do the digging and find the resources and the help that's available, and get that parent through the crisis that they're in, the challenge that they're facing, and just continue to be a support to them for the duration. So we usually say birth to death, or from the womb to the tomb, because that's the length of time that we will work with the family or an individual with a disability. So you can know that when you refer someone to our organization, we don't just answer the question or give them a resource for that particular challenge that they're facing or need that they have. We continue to follow that family for as long as they want us to. You can also volunteer at one of our events. Most of our offices have pretty small staffs. When you look at the amount of work that we're able to accomplish and the depth that of outreach that we have, it's often surprising to know that our offices are staffed with 4 to 7 people, just depending on which office in which region. So if you look at the 10 centers, you are probably looking at between 75 to 85 staff members as a whole across the state of Louisiana. The team of folks that we have are dedicated to the work that we do because we are families of people with disabilities. And so volunteering at an event gives us the opportunity to have some help that we wouldn't otherwise have, and helps us accomplish whatever that we're trying to do at that particular event. You can also serve on the Families Helping Families Board of Directors. We would like for the majority of the people on our board of directors to be parents or individuals with disabilities themselves, but we also rely heavily on professionals in the community that have a passion for special healthcare needs and disabilities, as well as our families. When you do this kind of work, you have a different insight than someone in another organization or business. And that's the kind of people that we want offering leadership and guidance to us on the board of directors. You can also be a sponsor at one of our fundraisers. You can participate in one of our fundraisers, make a donation to our organization to support funding for wipes and diapers. If I had a nickel for every time that we've had a phone call from someone that is looking for diapers, and that is across the network of Families Helping Family Centers. That's one thing that we always encounter. People typically forget about the cost of bladder and bowel incontinence when it moves past a typical age. And I just did some research on what that cost is that extends to our families. And while Medicaid may provide for diapers after a child is past that 4-year age mark, they don't provide any other incontinence supplies to a family. Recently speaking to parents who had children with disabilities, and these are children past the 4-year age mark, I learned surprisingly that a parent who has an older child, past 4, a 10-year-old or a 14-year-old, may go through as many as 60 baby wipes a day in order to clean their child after a bowel movement. And that's, when we think about it, we're always going to think about what we had when we had babies, 3 wipes and you're good to go. And you might have to change a bowel movement a couple of times a day, and then you use 1 or 2 wipes after just a urine diaper. We're not thinking about what happens if you have a 12-year-old who has a disability that prevents them to be able to move or change positions, and what that might mean for the parent when they're changing that and the number of wipes that you're going to have. So I was blown away that parents are paying for out of their own pockets that number of wipes, and that just continues that cost just continues to increase the older the child gets and the bigger that they get. And so anytime that we have funding that we can supply diapers and wipes, it's always a much needed resource to the families that we serve. And then, like I said, most importantly, make a referral and tell people about our services. Call our office and ask us to come and speak if you work at an office and you all need more information on the services that we provide. If you need to give a family more support than you're able to in the particular line of work that you're in, send them to our organization, because we're going to help connect the dots. We're going to make sure that they're connected to their human service authority or district, so that they don't have to sit around and say, I have to live forever, or I have to carry my child with a disability once they're an adult into the nursing home with me, because my son has a statement of approval from Northeast Delta Human Service Authority. So, and this may sound silly, but I can die, and now, not that I'm planning to anytime soon, but when my time comes, and know that he has a statement of approval, so he now qualifies for resources to continue to live in his own home. And while he will have the loss of me in his life, it doesn't have to change his life too drastically. He can still have support with the things that he needs support with that are based on his needs, and not a one-size-fits-all kind of approach to things. They can assist him in the areas that he just needs that assistance. I don't have to worry about that being a burden on my other children, or expecting a family member to take on the responsibility of that. And that's one of the things that we, both agencies, try to do, as well as all of our other Families Helping Family centers across the state, is to make sure that we're connecting those families long-term to the resources that they need. Because we're going to encounter families when they're in a crisis situation. For us, oftentimes it's an educational crisis of some kind, and we do a lot of assistance with school IEPs and 504 meetings. But you have to think past just this year's IEP or this year's concern at school, and you have to think about what you're going to develop long term. But you also have to know when the right time to have that conversation is. Dumping that information on a family who calls us sobbing because they're in the midst of a severe crisis is not going to help them at all. First of all, they're not taking that information down. They need to get through what's on their plate right now, and they're living kind of in the moment. So when things have resolved themselves, then we want to work with them to make sure that we're connecting them to their human service authority and to the other resources in the area that they need for their long-term plan for their child. Typically, parents of children with disabilities are not thinking past whatever place that they're in their life right now. And so we want to work with them to make sure that we're helping them develop that long-term plan. And so it's really important to refer those people to us or make that connection yourself. This is how you can get in touch with each of our offices. you want to take a minute and snap a picture of this. And like Monica said, this will be on their YouTube page, and we'll make sure to share the recording as well so that you'll have this information as we go.
So we have, I'm seeing a couple of people, once it hit 2 o'clock, I've seen a couple of people drop off. So I don't want to, and I need to, I'm going to put the survey to be able to get the CEUs or a certificate. I'm going to put that in the link in a second. So I'm going to have to be doing some maneuvering. I thought, before you get on to, and we actually start asking questions, I would like to ask a question. And I thought if you could just put it in the chat, because I am going to go in and like save the chat so that we'll have documentation of it, because some people ask things and, you know, all that kind of good stuff. So I wanted to ask if you actually scanned any of the QR codes that you saw today, or did you click on any of the links that we put in the chat? I'm just interested to know, are they, you know, I mean, is that something that you do, or, you know, does it work? Did anybody utilize or scan any of the QR codes today? Because here is the code for, I believe this one is for Families Helping Families Region 7. And then the information, you know, for all of our email and all that's on here too. But so if you would just do that for me, you know,
We had
just
several that did. And I did. When I clicked the link and then emailed that to myself so I wouldn't lose it for later.
Did you?
And did the QR code. So
Okay, so I'm gonna go ahead and let you kind of go over this and wrap it up, Stacy. And while we're doing this, I'm gonna try to leave this up as long as I can, since it does have all of our contact information. But I'm gonna try to get into get the survey, and then I'll so if you want to do the questions real quick.
So that is in a nutshell the Families Helping Families organization. I know we threw a lot of information at you, and that's why we want you to always remember that you can reach out to us to do a presentation at your office, or set up a time to do a Zoom with you. Come by and see us, you know, whatever works best for you. We want to meet you where you are. Does anybody have any questions about the Families Helping Families organizations? One of my board members is in the chat saying that she just joined as a board member. Miss Gwen Amelin over from Northeast Delta Human Service Authority said it was a great presentation and information. She's one of the professionals that we work closely with and share resources and information with all the time. Someone said that we serve a great purpose and are helpful to the families in need. We appreciate that. And we want, Chanel, the director of Region 7, and I just attended a social work conference at Grambling, and we were both surprised at the number of people who didn't know about us or didn't know that we can help become part of your case plan for a family or a child with a disability. So that's what we want you to take away today, is to hang on to that and remember that we're available as a resource. While we had those phenomenal numbers of all the outreach and the trainings that we had, there are still so many parents who don't know that we exist, don't know that our human service authorities exist, early steps. So we have our work cut out for us, and we want you all to you know, just kind of make a commitment to us that you will remember us and make that referral or make a phone call yourself when it's appropriate, and we can do something either for you professionally or for a family that you serve. And I know we're running past, so I don't want to just keep yabbering here. We have to give you a little bit of house cleaning information so that we can wrap up and you all can get your CEs and or your certificates after today's training. So I'm going to turn it back over to Monica.
Yeah, I'm gonna actually click off. I did it. I wanted to make sure that we had our, hold on, I'm sorry. I put the link. If somebody wants to click on it, I always suggest, you know, sometimes they send an email after the fact. but I always suggest, like, right now, it's up there, you're here, click on that link if you can, and go ahead and fill out this survey. So for you to be able, for our participants to be able to get a certificate, or if they're eligible for the CEUs, it's 2 contact hours of CEUs for nurses and social workers. Then what you have to, the only way you can get those is to fill out the survey. So that's why I say do it now while we're still on and it's on your mind, and fill out the survey, and it'll tell you, it'll ask you, do you need nursing CEs or social work CEs or a certificate? So, but we do, our Bureau of Family Health, our contractors, they want the information, they need the survey information to make sure we're doing what we're supposed to be doing at Family 7 Families. I can guarantee you we are. But by also filling out this, there's certain requirements for those CEs and CEUs that are necessary, that the information that they get from the survey are necessary to be able to issue those. So if anybody is in need of their CEUs or a certificate, go ahead and click on that and make sure it works, and do it now. That is the only way. So, and I know I've said this before at the beginning, but some people may not have been on right at the very beginning. But if you are watching this recorded version of this, because it'll be out there, then you are not eligible for the CEs. So the only ones that were here with us today on April 19th from 12 o'clock to 2 o'clock, or 12:05 to 2:05, then those are the ones that are eligible for the CEs. So, you know, when only the ones that attended the live event. So I'm not seeing everybody saying the link works, so that's good. I'm glad to know. I want to make sure, you know, things can go wrong. And we want to, and like I said, if you don't have the opportunity to do it now, if you're on your phone or anything else, you know, if you're not able to do that survey right now, it should be emailed to you after the presentation as well. But and if somebody is not able to get it, or if they're having some issues, then please make sure and just reach out to us. You can reach out to me or Stacy, and we'll make sure you get the survey link. They usually, and I'm not, this is nothing, you can't take me to court on it, but they usually keep this link open for about a week or so. And then also, it's about 2 weeks, and I'm going to say 2 to 3 weeks. I want to give us an extra little week, but you should receive your certificate or your CEs, you know, within 2 to 3 weeks. So it depends on how, because we do wait, they keep this open for a certain amount of time. That's why I like to say 3 weeks. They keep it open for a certain amount of time, and then once that's done, then they'll send us the report and the information to get those issued. So it is a process, and it does take a little bit. So be patient with us. And if anybody, like I said, if anybody needs to reach out, I'm going to put my information in the chat. I don't think we have anything else. I'm excited it's Friday. The anxiety has been great this week, because this is like a big thing for us to do. And Stacy, I really appreciate you. And I'm so glad you're talking, and I get chills, you know, when you're talking. And I'm just so glad that we're able to partner with you to be able to do this. And so, like, us in the north, you know.
That's right. We have to stick
I know we
together
have a lot of people from down south on there, but us in the north. So
we love all of our southern compadres down there, but we know that y'all joke that we're not really Louisiana, so we have to stick together up here.
right. Right, that's so
I
true.
appreciate you, and I appreciate everybody that came today. I didn't sleep last night because this always gives me anxiety, and you worry about all the things that could go wrong, but we had such a great turnout. I was really surprised and happy to see a lot of friends that I know here that we work with in the community. We didn't have any crazy glitches. We appreciate you sticking in for the whole duration of the training. We know that 2 hours is a long time, and it's a long time to sit in one place. Well, you all have the luxury of being able to move around, but to get that much information in that quick of a time frame. So we encourage you to please reach out to us. We want to partner with you and let you be part of the work that we do and part of our organization and work together. We're all in this together, and we can make a great impact together as a unit with the work that we do. So you all have a great rest of your day and wonderful weekend, and we look forward to seeing you all in the future.
All right, thank you. I'm gonna put this in the chat just in case one more time. And then we're gonna end it. Thank you so much.
Thank you.